So from the doctor's side, there's a need to kind of put aside some of that distrust and judgment of what industry is and what industry offers. Um, and I don't. I think that a lot of that comes just from historical relationships, and that information is fed down and inherited by new junior doctors who come into the system. That for some reason, industry is um, a bit dirty almost as a word, and yeah, I feel like there's a need to start to change that mindset. That needs to come from both sides, and there's a meeting point in the middle. I think it's for clinicians to be a bit more mature, I guess, about the ecosystem that they're operating within, and for industry to exploit some of the easier wins to meet clinicians at their level. The industry for some time now has recognized that, and has started to try to make those relationships. But sometimes I do think as well, is there an opportunity there for industry to actually head straight to the patient increasingly, and maybe the relationship with clinicians will improve off the back of that. Almost to be seen to be making change and delivering something directly to patients, which may win over the kind of the audience of clinicians, secondary to the intervention. And I guess by that I mean um, looking at opportunities, particularly in secondary care settings, to educate patients about their conditions. Work with patients around motivation for change. Like these are things that industry could do actually in quite a hands-off way now with the digital capabilities that exist, and it may just be a slightly faster way of then generating improved relationships with clinicians than trying to slowly go after clinicians themselves and get them to change their opinion.